back to Dr. Noah's YouTube updates, and I go through the scientific literature every week and some interesting things on different other type of nutrients out there. This is a study that came out of Tufts University, published in Clinical Endocrinology and Metabolism, October 2011, showing that taking good kind of fats helps vitamin D work well. Now, vitamin D is in a classification called fat-soluble type of vitamins, and so yeah, it would make kind of sense is that taking good type of fats actually makes that particular type of vitamin, even though it's more as a type of anabolic steroid hormone, to work more effectively. We've talked endlessly about vitamin D is so critical. Definitely you have to have, if you can, get it tested with a 25-hydroxy D3 test. Find out if it's at least above 50. Some people think it should be over 70 in terms of the value of whether or not you either have enough or don't have enough. You should be on this if you're deficient. Even drug doctors now are started coming on board and understanding the thousands of scientific studies out there in terms of the benefit in terms of their patients, in terms of making them healthy. So that's an important factor like that. Next study is on from rheumatoid arthritis, Journal of Nutrition, Health, Aging, and this comes from actually out of Finland, is that taking certain types of branched amino acids help with this devastating type of disease. Now, there's two kinds of arthritis: osteoarthritis and rheumatoid arthritis. Osteoarthritis is considered the wear and tear, so think of it like a car. The more miles you have on the car, or how old that you get, there's a greater tendency for your joints to be able to wear out. Just like an old car that has 10,000 miles, their parts are pretty new, and a car that has 200 or 300,000 miles, the parts can be worn. Now, some of that is, once again, deceptive, because if you do the right things early on, you don't have to go into osteoarthritis. You can prevent it, but most people don't do the right things. They listen to their drug doctor, and of course they don't know anything about preventing things. So as you get older, your joints do start to deteriorate, and we see that on x-rays and CT scans, and you might have gone in and had different types of back or wrist or elbow or knee problems. This is the reason why they go in and do different replacements for hundreds of thousands of dollars. Well, those are all preventable, and we'll have some other videos coming about using natural things to increase stem cells in your own body to be able to actually rebuild even if you have that. So this study showed that, in terms of taking a particular type of amino acid, that they were able to increase muscle mass, increase jump power by 3%, improve walking speed 5.3%, increase lower limb muscle mass by 1.3%. And so that shows functional improvement in terms of this devastating disease where people get worse and do less. They function less to the point where they become totally disabled. Next study here, a meta-analysis. This is from Italy, published in Journal of Cancer Research Clinical Oncology, October 2011, that chemotherapy-induced anemia. So we've talked about chemotherapy, what a joke, except for about 5% of cancers out there, pretty much worthless. The largest study, another meta-analysis looking over 900 scientific studies showing that at best chemotherapy might increase survival time by 2.1% over 5 years. So it costing hundreds of thousands of dollars, showing, causing great damage to the body. Chemotherapy causes cancer. I mean, we've gone on like that. Well, this is just another type of side effect of that. People that are on chemotherapy become anemic. And so just kind of common sense, this study showed that, you should be taking some type of iron supplementation to kind of counteract that. Next study that we talk about here in Biological Trace Element Research, November 2011, and this comes from out of actually Turkey, is using a particular type of compound that, has been really interesting to me, is CoQ10, for a problem that's called chronic obstructive pulmonary disease. Devastating disease. It can be due to, of course, smoking cigarettes, air pollution, industrial type of waste, where your respiratory tract is somehow compromised, where it's harder and harder for you to breathe. I mean, it's a really devastating type of disease. I mean, not only does it cause you to be able to do less because you just get out of breath, I mean, you actually literally are suffocating to death slowly. Well, in this study here, as we just quoted like that, showing that CoQ10, actually some other minerals, copper, zinc, and what was interesting about this, lipoperoxide levels in patients. Lipoperoxide is what Protandim is able to reduce. In fact, they used a marker called T-bars, which is actually a direct marker of lipoperoxide, and they was able to reduce the oxidative stress or lipoperoxide levels down to a baby in 30 days, even with individuals 70, 80 years old. And so that was kind of exciting. So there is other options out there. This is one that, people just really kind of just throw up their hands and give up. They walk around with oxygen tanks, and there are things that can be done to make your system become more effective, try to slow down and actually stop the progression of chronic obstructive pulmonary disease. The next study here from the Nutrition Metabolism, August, and this is from, where is this from? University of Minnesota, showing that beta-glucan, one of my other types of really kind of remarkable type of compound, I talk a lot about it in my practice and on TV and on the YouTubes here. Beta-1316 glucan is a natural type of compound that's been around for billions of years. And it's evolved with different type of species, and it really has a very profound effect on terms of helping the immune system. People fight viruses, bacteria, fungus, yeast. It's a broad spectrum. It's great. For yeast infection, there's like nothing better out there. Well, in this study, they actually showed that this goes beyond just the immune system and actually regulates sugar levels. And in this study, they were able to show, in terms of benefits in a very short amount of time, that these glucans, beta-glucans, are able to help with, different type of sugar disorders, which is type 2 diabetes. Now, the struggle for me is that type 2 diabetes is 100% curable. It's a lifestyle problem, and if you change your lifestyle within 3 to 6 months, people once again are, quote, cure type 2 diabetes. Well, how can you cure something that you created? I mean, you created. If you drive down the road with your foot on the brake and burn out your brakes all the time and tires, whose fault's that? You're just, once again, it's a behavior and an activity. Change that activity, then things happen very quickly. But it's a multi-billion-dollar industry. It's $30,000 a year for drugs and drug doctors to make over a sick disease called type 2 diabetes, which increases strokes and heart attacks by 250%. Number one reason for blindness, amputation. I mean, it's a devastating disease, and that's a tragedy. It's 100% curable. And studies after studies show that. And on my TV show, I actually have little clips showing that lifestyle is 300% more effective than taking a hypoglycemic agent drug. I mean, but one cost $1,000 a year, the other one cost in 2005 $31,000, and that's where the bucks once again dictate with the crappy care that you get there. So if you have type 2 diabetes, then you need to be able to be looking out, and we'll have a doctor you here, different steps that you can take, or see a functional medicine doctor or a natural doctor that can help you with his or her expertise to give you the guidance to really change it. Now granted, you're going to have to do some things, change your diet and exercise and do these, reduce stress. If you do that, 3 to 6 months, your type 2 diabetes can be cured. So everybody have a nice, happy Thanksgiving, and we'll see you next week. Thanks.